The negative responses are in a general dentist's office, usually post-op sensitivity in some way. It hurts or it feels too high. It's usually, frankly, it's usually bite related. It's some occlusal problem that's causing it,
Okay.
or which is an easy problem to solve, by the way.
Yeah.
And it's interesting because I have insight into what's going on there, right? And so that's not a particularly hard problem to solve. There are products out there
But it's
that
very
make that.
disruptive to life.
Well, it's a big problem for the office too, right? Because if you're thinking about a practice running on a profitability perspective, right? Every time the patient comes to your office, there's a setup and breakdown charge that you have to pay your assistant, and there's
There's a
a,
cost.
a
There's a hard
cost to
cost. There's
doing
a
it, right?
fixed cost. Yeah.
So if you're taking, let's say you are in network with a lot of insurances, you're taking a 50% write-off on some of your fillings, and so your profitability on doing a filling on a patient is, let's say it's only like $20 or $30, right? And then they have post-op sensitivity and they have to come back for an occlusal adjustment, and it costs you $50 to set up the room. So you lost
Wow.
$20 on that patient, from the get-go, right? So there's a lot of value in looking into that kind of data to see where improvements can be made. But to go back to your question, I mean, it's a lot of that. It's a lot of bite is off. This is a problem. Some people have issues with cosmetic stuff. I want to change this or that.
Yeah.
With extractions, it's,
Do
this
they
is
ever
still
respond that
sore.
they
This
don't
is
like the
bothering me.
doctor or something, or no, because it's the doctor texting them? I imagine that they probably would say.
No, and what is really, really interesting about it is that I know some of the doctors who are using it personally, and I know that they are not the most personable people. And even still, their feedback is fantastic from patients. So you can actually overcome your own,
Yeah.
personality flaws with just being nice.
Yeah, being nice and reaching out.